I'm going to do an incentive spirometry. So the first thing I'm going to do is check the patient's chart and see if they're going to be a post-op patient or if they're an elderly patient that just needs to work on their lung volume expansion. So once I am ready to go into the patient's room, I am going to knock on the door, introduce myself. Hi, my name is Amy and I'm a respiratory care student with the respiratory care department. And then I'm going to check their ID band just to make sure I have the proper patient. That way I don't give the wrong patient the wrong treatment. So I have the correct patient, and then I'm going to wash my hands. My hands are clean, dry, and then I'm going to auscultate the lungs, listen to the lungs, and then I'm going to look at their vital signs to see where they are at before the treatment. So once I am ready, I can get their machine ready, and before every treatment I need to explain to them what the treatment is. That way they have a good understanding on how to use the machine. So today I have a volumetric volumizer here. And so this here is a machine. This will help them strengthen their lungs, to expand their lungs and inhale bigger. That way they can be able to cough up anything if they have anything, and after post-op surgeries, that way this can help them open their lungs. That way they don't have atelectasis after be sitting down for a little while if they're bedridden for a bit. So here we have a metric here. So this always needs to sit upright, and here we have inspired volume. And with every machine here, we have a chart, and it goes based off of female or male, and then it goes by age or height. And so for me, I am going to do in between 20 and 25, so 1900, 1850, in between there. So I'm going to set it there, but if they're post-op or an elderly patient, I'm going to start them out at a lower inspired volume. That way, then I can have them set a goal and just to kind of see where they are at. And if they can't quite get to where they need to be, then I'll start them either lower. That way I can just get them to work up towards to where they need to be. So after every one, I need to let them have rest, and they can do it 6 to 10 times per hour, just depending on their situation and if they are having difficulties with doing it. So I'm going to set it up. I have a mouthpiece here. I'm going to put it in here. And then when I'm ready, I will demonstrate for the patient first before I let the patient do it. So I have it attached for the patient, and I'll instruct the patient to take a normal breath in and then fully exhale. Make sure that all the air is exhaled, and then when they inhale, put their mouth over the mouthpiece and make sure their tongue is underneath and they don't obstruct the opening. That way I get the appropriate reading. So I'm going to have them inhale and then exhale. And when they inhale, I have them hold 3 to 5 seconds, just depending on how long it takes for the piston to go back down to the bottom, to reach the bottom. And when they exhale, I'll have them exhale away from the mouthpiece. Now for a post-op patient, it may be uncomfortable for them to sit up, so I can have them have a pillow in front of them. And then anytime that I have moved a patient up in their bed from where they were laying, I can move them back down when they're done with the treatment. That way make them feel more comfortable when they're back to normal. So when they are done with this, and if they are not done for that hour, I can set it next to their bedside, somewhere where they can reach it to practice and continue to reach towards their goal that they need to meet. So once I'm done, I'll remove this, and then if I am finished with this, I can clean the mouthpiece off, and I can cover this up, place it in the appropriate bag. And at the bottom of this machine here, there you can put the patient's name, patient's room number, and the date that I have given them the machine. Place it in the appropriate bagging. Just to protect it from anything or bound things, anything like that. And so after a treatment, I'm going to wash my hands, dry them, And then I'm gonna reassess the patient, check their vital signs, listen to their lungs to see if I hear any abnormalities, if it's helping them with the breathing treatment, helping them open up their lungs more. Once I am done, I'll make sure my hands are clean before I leave the room, and then I'm going to chart everything and let the physician or nurse know what went on.